Welcome back to Dedicated Dentist, where we probe dentistry 32 reasons why. This video is about the anatomy of permanent maxillary first molar. So, maxillary first molar erupts at around 6 years of age, but mandibular molars always precede, that is, erupt before maxillary molars. Maxillary molar is not a succedaneous tooth. That is, it doesn't replace any tooth. It erupts along the distal surface of deciduous second molar, as you can see here in the picture. So there is always downward and forward growth of the mandible going on, which accommodates the tooth. Okay. So first molar is, you will learn about this downward and forward growth of mandible in your final year in ortho and in the chapter growth and development, so you'll understand it better. So this downward and forward growth of the mandible will accommodate this tooth. Now, there are 4 cusps and 3 roots: mesiobuccal, mesiolingual, distobuccal and distolingual cusp, plus there is an additional cusp that is called as cusp of Caribelli, and roots mesiobuccal, distobuccal and palatal. This is the largest tooth in the maxillary arch, and it has this various grooves, central groove from which arises various supplemental grooves like buccal groove and lingual groove that extend between the lingual cusp, and buccal groove in between the extending till the on the buccal aspect between the two buccal cusp. So there's this additional fifth cusp groove present along the supplemental cusp that we call tubercle of Caribelli or cusp of Caribelli. There are ridges and elevations also present, like on the mesiobuccal cusp, there is mesiobuccal cusp ridge. Similarly, for the distobuccal cusp, there are distobuccal cusp ridges. There are major foci and minor foci, and this pink highlighted area is the central fossa. And there's also this distal fossa, and minor fossas are mesial triangular fossa and distal triangular fossa. Oblique ridge is another important feature of maxillary first molar. It is the union of triangular ridges of the distobuccal cusp and mesiolingual cusp. It provides stability and strength to the tooth. Hence, when it is not involved by caries, we do the conservative preparation in maxillary first molar. From the buccal aspect, the crown is trapezoidal. 4 cusps can be seen from the buccal aspect, and the mesiobuccal cusp is broader than the distobuccal. Also, the mesial slope of the mesiobuccal cusp meets its distal slope at obtuse angle. That is, the mesial and distal slope of the mesiobuccal cusp, they form an obtuse angle, whereas in distobuccal it forms a right angle. Thus, distal cusp is sharper since it is forming a 90-degree angle, and it is also longer than mesiobuccal, but mesiobuccal is broader than the distobuccal. Also, you can see the buccal developmental groove arising from the central groove, like we already discussed, and the cervical line of crown from the buccal aspect. It doesn't have curvature, it has convexity towards the root surface. The distal surface is convex or round, and the mesial outline or mesial surface is straighter from the buccal aspect. And 3 roots are evident from the buccal aspect. The lingual root is the longest, distobuccal is the shortest, and mesiobuccal is broader. So it has resistance to the torsional forces greater than the lingual surface. The apices are slightly distally tilted, and the mesiobuccal curves distally more. So by point of bifurcation, that is part at the base of root trunk from where the roots arise, it is 4 mm from the cervical area. Then from the lingual aspect, only the lingual cusp is seen. The mesiolingual cusp is the largest and longest. Then angle is formed by the mesial and distal slope of mesiolingual cusp is also obtuse. The distolingual cusp is also seen. It is smallest and it is spheroidal and round. Then you can also see lingual developmental groove arising from the central groove. Fifth cusp or cusp of Caribelli, it is present on the mesiolingual surface outlined by a developmental groove, and all 3 roots are visible from lingual aspect, but most of the part is taken up by the lingual root. Then coming to the mesial aspect, make sure you draw these diagrams or remember these diagrams so that it will be easier for you to recollect the points during exam. So the buccal outline, from the mesial aspect, the buccal outline is convex. You can see the crest of curvature is present in the cervical third. There's this shallow concavity above the curvature on the buccal surface, and from this mesial aspect you can see the mesiobuccal, mesiolingual and 5th cusp. If 5th cusp is present, lingual outline, it dips inward. The mesial marginal ridge, it is confluent with the mesiobuccal and mesiolingual cusp ridge. The cervical line here is irregular. The mesial contact area is apical, that is below the mesial marginal ridge, and it is slightly towards the buccal side between the occlusal and middle third. The mesial buccal root is broad and flatter and had flutings on the surface. Flutings are the vertical depressions present on the root surface, which is rare. And from the distal aspect, the crown tapers distally and appears smaller. The distal marginal ridge, it dips cervical direction. The cervical line on the distal aspect is straight. Then distal surface of the crown is convex except near the distobuccal root in the cervical third, and bifurcation is from 5 mm from the cervical line. From the occlusal aspect, maxillary first molar is rhomboidal and it is wider. The crown is wider mesially than distally and it is wider lingually than buccally. So 4 cusps are seen with small and fifth cusp on the lingual surface, and the fifth cusp can be very evident or distinct, or at times it can be indistinct or cannot be seen or is very small. Sometimes only developmental lines are present along the mesiolingual cusp. So the mesiolingual cusp is the largest and the order is which is followed by mesiobuccal, then distolingual, distobuccal and the fifth cusp, which is the smallest. The acute angles are formed by the mesiobuccal and distolingual cusp together. Obtuse angle formed by the mesiolingual and distobuccal cusp. So the primary cusp are buccal cusp and the mesiolingual cusp. Distolingual is common to all maxillary molars. The cusp of Caribali or the tubercle of Caribali is the secondary cusp. So distal lingual cusp, it gets smaller progressively. That is, it is largest on the maxillary first molar and then smaller in the second molar and the smallest on the third molar. So this arrangement, this triangular arrangement of these cusps is called as the maxillary molar primary cusp triangle. On the occlusal surface, there are two major foci, that is central fossa and immediately distal to it, distal fossa, and two minor fossas, that is mesial and distal triangular fossas. And we already discussed this, that the mesial marginal ridge, it is confluent or continuous with the ridges of mesiobuccal and mesiolingual cusp ridges, while the distal marginal ridge, it dips cervically and it is confluent only with the cusp of distal cusp, ridge of distal cusp. And the oblique ridge is the union of the triangular ridges of the distobuccal cusp and distal ridge of the mesiolingual cusp. The central fossa is a concave area bounded by the distal slope of mesiobuccal cusp, the mesial slope of distobuccal cusp, oblique ridge, and ridges of mesiobuccal and mesiolingual cusps. So in the center of central fossa, there is a developmental pit from which arises the developmental grooves, that is buccal developmental grooves that radiates on the buccal surface between two buccal cusps, and lingual developmental groove on the lingual surface. Another developmental groove radiates from the pit of central fossa and it fades out before reaching oblique ridge. That is, it doesn't cross the oblique ridge, or sometimes it crosses the oblique ridge transversely, which is called as transverse groove of oblique ridge. There is a distal oblique groove which connects with the lingual developmental groove, and the developmental groove that outlines the cusp of Caribali or the fifth cusp is called as the fifth cusp groove. That was all about the anatomy of maxillary first molar. I hope you liked the video.